Hello, everyone. Good morning. Welcome to Data Ethics for All Live, where we have intimate discussions with data ethics trailblazers on the future of data and AI. I'm your host, Shilpi Agarwal. Today's topic is really the need of the hour. We are going to talk about bias in AI, in COVID healthcare solutions, and it gives me great pleasure to welcome my guest, who is a Google product lead for Europe, Middle East, and Africa. She is also the project manager for Women in AI Ireland and founder of Refine. Please welcome Toju Duke. Hey, Toju, welcome to the show.
Thank you. Thanks, Shilpi. Thanks, everyone in the Data4All Ethics group. Happy to be here.
We are so excited to have you. I mean, this is a conversation I think that's top of mind these days, right? I mean, with COVID, coronavirus has forced its destructive path across countries, across communities, and across economies. In fact, I was just reading today, worldwide, the confirmed number of coronavirus cases now is 12.2 million, with 6.7 million recovered and 552,000 reported deaths. I mean, that's like an unforeseen number. That's a huge number. So this pandemic has taken lives, it has damaged health, and produced a historic economic decline. But it seems like COVID-19 has a disproportionate impact on communities of color. Can you elaborate on that a little bit?
Yeah, happy to do so. So, like you said, I'm just going to echo what you said, right? It's like I was just thinking about the talk and thinking about, 31st of December 2019. Everyone was, singing Happy New Year. Lots of news lines and recounts of what's happened in the past decade, the triumphs and the trials, people who had passed away, people who had made victories, the best companies that had made, the highest turnovers and all of that. And everyone was excited going into the new decade, 2020. And come 2020 now, we're just in the second half of the year. I personally can't wait for 2020 to be over. A lot of people echo the same sentiments. Like, it's just been a very interesting, and I don't want to say dramatic, but there's been lots of things going on in 2020 that have been unprotected. Yeah. And that goes back to, the racial injustice and systemic injustice that we're seeing. And I believe it's a good reason, but for some reason now it's being resurfaced in 2020 with all the things that have happened with COVID-19, with, the recent Black Lives Matter protests, due to killings of Black people in the US. Racism and systemic injustice are being brought up again, right? There have always been conversations around them. I think now more people are beginning to understand what, people of color and communities have been singing about or crying about for a very long time now. But something struck a chord across everyone when we all watched the video of George Floyd, what's happened. And I found it really interesting to see how, COVID-19 is almost like still a racial problem, right? So it's almost like, people of color, minority groups, disadvantaged groups always get the brunt of anything bad that happens in society, including COVID-19. And yeah, when you look at, data right now, people of Black descent or, Latino descent in the US, for example, are 3 times more likely to get virus. And they're 2 times more likely to die. Like, data and statistics show that Black and Latino communities right now have died from coronavirus, and death rates is 2 times more than what was expected.
Yeah. So is there a particular reason why it has impacted minority communities more? Is there education, the way we live, our lifestyle? What is affecting one versus the other more than usual?
Yeah, so when you look at the data in terms of incomes, right? Yeah. People from the minority groups are earning half than the national average income. Yeah. That means that they cannot really affect social distancing measures in their communities because they're all sharing, apartments and sharing houses. And then when it comes to their jobs, their jobs are mostly frontline jobs. So even if some of them, are like middle class and some are doctors and nurses, they're still jobs right there on the front line. And because they're already in a disadvantaged community, they need to go to their jobs. Most of the jobs, they can't work remotely, they can't work from home. They have to be out there in their jobs, right? So we have jobs like doctors, nurses, bus drivers, shelf stackers, technicians, production line jobs, service jobs. All these jobs, people need to be out there, in the front line, rubbing shoulders in public transport, rubbing shoulders with everyone else and being exposed to the virus. And I think, along those lines as well, there's been some form of unconscious bias in terms of the treatment that they receive, in terms of hospitals, doctors showing some form of discrimination to people of color, and even in terms of, prioritizing who to be treated. We've heard stories of people of color, Black people, being sent back home, even when their coronavirus case was so severe, but they're still sent home, not treated, and they died. And in a time of pressure, that's what is the things inside you that come out the most, right? So all forms of biases and unconscious biases. Doctors are being pressured right now. They're like soldiers. They're right there in the front lines, like the military, taking the bullets of this virus. In that sort of situation, it's very hard for them to make objective decisions when it comes to who do I prioritize based on the symptoms that we know or that we know should reflect how severe the virus is in the patient.
Toju, I have a little comment about the voice. Your voice seems to be going in and out. Is there anything we can do about it?
No, I don't think so. The problem is it better now? Can you hear me better now?
Yeah, it's better. Is it coming from your laptop or is it?
I think it's my laptop. The problem is I'm not even using my own laptop. I could try to use headphones. Would that work?
This is better. Maybe coming closer to the device.
Gotcha.
Some static and it goes in and out.
Okay. I'm sorry about that.
No. I mean, this is such an important discussion and I don't want to miss out on any little detail.
I would have used my work laptop, which I use all the time, but Google and Zoom are not friends, so I can't download Zoom on my work laptop, so I had to borrow.
We should have Google Meet today.
I have to move to Google Meets.
Yeah, we should have used Google Meet today. I apologize. All right, cool. So this is much better. Does this work for you, Toju?
Yeah, I was hearing you okay anyway. Let me know if you can't. Feel free to interject if you can't hear me, and I'll try and find a solution.
So I'm really appalled to hear that even the doctors, frontline workers, they are like making the best judgment as much as possible as they can. And we have heard stories, not just sending people of color home, but we have seen that they also send so many other people home. They treat like a younger person more than an adult, like a senior citizen, because they have to make a judgment. I don't know how they are making this humanitarian judgments, playing God here, but it must be probably very difficult for them as well, as I can imagine. Playing God is not easy. Taking the decision of who gets to be treated versus who gets to be sent home and for how long and all of that must be hard for them as well. But if they are consciously making these any kind of biased decisions, then of course that's not human as well, right? So let's talk about the apps that are being developed. Like there are just so many. App-based contact tracing is appealing in part because the coronavirus spread is so stealthy. Infected people transmit the virus for days before they develop symptoms, and it can take several more days for public health investigators to learn about a case and confirm it with the testing, right? These teams have precious little time for traditional contact tracing, that they go in, interview an infected person, track down everyone who has come in recent contact with them as much as they can recall. I mean, it's hard. If somebody asks me what I did over the weekend, I sometimes forget, or even yesterday, right? I mean, we are all, we do so much. It's hard sometimes to recall. Sorry. And then getting to those people self-isolate before they too pass on the virus is difficult. And by the time you get the data, you have a couple of days to chase people down. Says C. Jason Wang, a health policy researcher at Stanford University, So if smartphones could detect the two users who are close enough to share the virus with an app that could alert one person as soon as the other person gets sick, it looks like a promising solution. So how has AI been applied to COVID-19 contact tracing applications and healthcare in general?
So I think with the contact tracings, there's still a bit of a controversy there, but I'll just touch into it a little bit. So AI does use
So much controversy, and I don't want to. Yeah.
everywhere AI, but I mean it uses the location tracking capabilities, right,
Yeah.
of the people who have caught the virus, and it helps them determine where they have been, who they've been in contact with by looking at the location.
Yeah.
So we have a few countries who have adopted it, like South Korea and Taiwan, and of course China integrated it in some of their main apps, like their Alipay apps and their WeChat apps, which are major apps that are used by people in China, by the whole China country in China. Sorry, I'm muffling now because I'm wondering, can you hear me okay? Because it seems like the laptop is firing up again.
Yeah, it is sort of, but there's some static and there's some echo in the background.
It seems to fire up, and when it fires up, that's when
Your
the sound is.
your voice and passion in the voice fires it up, I guess.
I hope I haven't got COVID-19.
I will blame it on that.
Okay.
It's fine. Let's keep going.
Okay, perfect. So we have the likes of the countries in Asia all using these contact tracing apps.
Yeah.
Countries in Europe are slowly adopting it as well, but the Norwegian government, for instance, have decided to drop it mainly due to privacy issues, right? So if it's collecting people's data, it's collecting people's data, amassing it in a database, and AI technologies are meant to be using that data to help provide solutions for COVID-19. But then there's a big question around regulations of privacy, user data and privacy. And if I had COVID-19, do I even know where my information, my personal identifiable information is being sent to? I think probably it's being sent to the Irish government, but I have no idea if people in China already have this information, because they can be selling it off to third-party apps as well. And that's the major controversy there, is if we do not have any proper global regulation around the use of privacy and people's data, especially around COVID-19, how much do we want to allow all these countries and companies to use this data? And that said, Google and Apple decided to come together and develop some APIs and some technology, and said they're actually going to work together to help, improve the contact tracing app. But they still want to make sure they protect user information as much as possible. So the big tech companies are still trying to provide some solutions to this problem, but it's a major problem that we're aware of.
Yeah.
And then I was actually just going to say, in terms of healthcare overall, right, there are lots of things that AI is doing, like, tracking surveillance around areas that have the most COVID-19 cases. We have chatbots, that help answer questions around it. Helping with drug development as well,
self-assessment cases, like, do you have it under questions? All that is done by chatbots as well.
Exactly. There's lots going on around data mining as well, and just helping to collate all the data sets that we have and build predictive computer models. There's lots going on around literature searches, digging deep into all literature to see if there can be any predictions and understanding more of this virus. So a lot has been going on in AI in the background, and which is all great news.
Yeah. And you talked about how many countries. In fact, according to top 10 VPN, today 50 countries, including some of the countries that you mentioned, New Zealand, South Korea, Vietnam, some parts of Africa and Europe, Russia, China, India, Australia, some states in the US, including North Dakota and Utah. They have all implemented contact tracing to some degree. Some have made it mandatory. Some have opened their APIs to, satisfy the more privacy conscious citizens. But at the same time, you also mentioned how Google and Apple have come together, and they're trying to provide some sort of guidelines around what the contact tracing app can or shouldn't do, what all data it should collect or it shouldn't collect. What is disturbing is also that 50% of these apps don't even have some sunset policies around what data they are, or even transparency around what data they're collecting, how long they will be collecting, even when the pandemic is over. So all those are really questions of concerns for privacy conscious citizens. And yes, it has led to a very big debate. And then there are also questions regarding the measures that it is taking, that it is, whether it is effectiveness of the measures of contact tracing. Do you think it is a viable solution to help COVID-19 in crisis?
I don't think it's a solution to, I think it's a solution that will help reduce the spread, ideally. Mainly because I'll give an example. In Ireland, the numbers were contained a little bit. It got to a stage where we stopped recording any new cases for days. And the main reason for that is because there was a lot of contact tracing being done. We didn't have the app at that time, but between the healthcare sector and the police force, they were really, and they always documented it to say, we're scrambling around trying to find everyone who the patients have been in contact with for the past 14 days to contain the virus. So I do believe that it can help contain it to a certain extent. Of course, it's not going to provide a solution or any drug, development to cure the virus or any vaccines, but it should be able to help contain it to a certain extent. In terms of percentage, I can't give any numbers right now because I haven't really looked into that detail, and I'm not even sure that data is available yet, but it's definitely a step towards the right direction.
True, very true. According to Douglas, a computer scientist at Trinity College, and Dublin Trinity computer scientist Stephen Farrell, there's two technologies, right? GPS and Bluetooth beacon. So they are, of course, we have identified that GPS is not as effective, but even with using Bluetooth beacon technology, the signal strength is much lower. There are some challenges, when two people are sitting in a restaurant across the table from each other, and if they have their phones in their pockets versus if they have their phones on the table, the signal that the Bluetooth sends is different. And so identifying who came in contact with whom is a challenge. Some of the other challenges are like metal reflection that plays a part in the sending of the signals, the strength of the signals of the Bluetooth beacon. So do you know of any other current challenges in AI that could affect the predictions and the results in patient diagnosis and treatment?
Yeah, I think what I'll mention right now is just the prevalence issue that's been raised recently is around bias in AI, because it still goes back to affecting the predictions that any AI system spews out in whatever industry, including healthcare and COVID-19. So I think it's well-known fact. AI data sets are really rooted in bias. We've had recent issues with the MIT tiny images, for instance, that was pulled out a couple of weeks ago, was it last week, mainly because of the issues it had with bias. And just to give some more context for people who probably don't know the story, MIT had a data set built in 2008. It was helping spew out high-res images. And it was working with another AI data set called WordNet. Now, the problem with that is when it assigns a text to an image, it could be very wrong, derogatory words. So, for example, it will compile a black man's picture with a monkey and use the N-words to identify it. Or a woman who's just carrying a baby, it calls her a whore. So there were a lot of things that were unearthed by scientists as well, research scientists, and some of them were in Dublin, that actually tested this model and saw that these are the sort of outputs that this model brings out. And it was announced in the press, and MIT pulled it back. The problem with that, though, is a lot of companies have gone ahead to apply this data set in their AI systems as well. So how much pulling back can we do, right? Or we have Amazon and IBM who have pulled back the facial recognition software because we found out that it has an issue. It doesn't recognize the black skin color. It recognizes more of a white skin color. Going back to tiny images. Or we have something else around Pulse. Pulse is another, data set that was built by Duke University researchers. And it still couldn't identify the black skin. So, you know, it's meant to have a blurry, pixelated image, and it's meant to be able to identify the person. And, you know, they imputed Obama's face into it, and Obama came out as a white man, or they imputed Muhammad Ali, and he came out with blonde hair, right? So again, this data.
There's a big feud on Twitter because of this, right?
Yes, I know. And Tim Gabriel has been doing a great job, you know, thinking about these. But, you know, it's not just around the data sets, it's around the historical and societal inferences in all of these, right? So if we have people that are building these data sets and they're not exposed and they don't have any form of diversity, you know, in their thinking, in their societal upbringing, you know, in their interactions with society, then it's very likely that the data sets will be biased in the sense that it's not going to represent a diverse an inclusive range of people and ethnicities and cultures and genders. And then the problem with that is, you know, if we have any AI systems that spewing out predicting solutions for COVID-19, once again, we already know what that means. The Black communities are being suppressed and oppressed by this. And I think that's part of what's happening, right? Because we do have AI systems that are predicting, you know, the severity of the illness and those who are going to have it in a higher severity than others. Most AI systems that do this work with image computer visioning or image computing. And if they are using that, these are already rooted in bias because most of them lean on ImageNet, which is another data set and another model that AI systems use.
Very true. Talking to Toju on AI and COVID-19 situations, and I'm going to pause here and take some live audience questions. You guys, I'll unmute and feel free to ask questions for Toju.
Hello, Shilpi, this is Terrence.
Hello, Terrence.
I put my question in the chat. I don't know if I should just read it or say it.
Just, yeah, short and if in a short way, if you can explain what you're trying to ask, then I think that'll be great. We have a few minutes and I want to get to a lot of.
If I'm understanding the conversation properly, you know, I don't see how emerging technology is going to change long-standing and pre-existing human racism and discrimination. It seems like it more so would be used as more of an oppressive tool and weapon, since it primarily appears to be dealing with the same bad actors. I kind of spoke to this in your last meeting, and it seems to me, you know, concerning the whole digital divide, that the conversation should be talking about how to get more oppressed and vulnerable populations into technology, you know, so as to positively affect their own lives.
I agree. Toju, go ahead.
I totally agree with you, Terrence. Whatever is coming down the line is not going to address these issues. It sounds more like we have to take a step back to address the issue. So one of the things I'm going to work on as well in the next few months is, you know, examining data sets in Google, coming up with best practices that we can apply in the industry, right? Looking at the amount of bias that we have in the current data sets that people are using, that companies and governments are utilizing, and making sure that there's some form of transparency and explainability in these AI systems. So we have a few tools that are already out there, you know, across the tech industries. For Google, for instance, we have something called model cards, where you can actually document the different models that you have for your AI systems. And if that's documented, and you know, you can still protect your IP and your patent, but if that's documented, then if someone has a question around the black box on the AI, hopefully those model cards should be able to give some more transparency into why that AI system arrived at the decision or prediction that it made. We also have something called a what if tool, where if that's implemented at the start of building that algorithm, ideally it should be more transparent and explainable. And I think that's where ethical AI comes into play, and responsible AI is making sure, you know, that whatever new AI systems are being spewed out, they're following some form of data ethics. And for the current AI systems that are currently existent, you know, making sure that we do examine them, right, and reveal any biases and any inaccuracies that they have. And that's what's happening today. And that's why, we have Amazon and IBM pulling out their facial recognition software. We have MIT calling back widely used data sets just because of these inaccuracies. We have Duke University researchers calling back Pulse as well. So we'll keep on seeing more of this. But I think what's important is for all of us to come together, right? When we identify these things, actually make some noise about it. Raise it to the right people. If more people come together to talk about it, hopefully, what I'm hoping is that globally we'll have some form of regulations, right? That is not too intrusive and it's not too dependent on the tech companies and the AI companies.
Yes.
But at the same time, right, there's still some form of guidance and some form of laws and regulations involved, so that the likes of these third-party AI companies, and there's one that I can't remember the name now. There's one that is actually being sued by the governments now because they just use the data, in the wrong way. That will be avoided. On the flip side as well, like you said, Terence, we need more diverse people working in these industries, right? Working in these teams, AI engineers, data scientists. Because if we have more diverse people, the new data sets that are coming up should represent what they believe in and the societal changes that are currently happening.
I think that's the key right there.
So picking back on Toju's comment on diverse teams and Terrence's question of, how do we include more diverse data sets? I think that's a great segue to talk about our upcoming hackathon, which is the Ethics for Next Generation AI Hackathon, that talks about it's trying to address both of these two problems. We are bringing people with cognitive diversity together in teams, and we are coming up with design thinking in tech. So we want to bring technical and non-technical people together to come up with creative solutions on how to build more inclusive AI for the next generation. How do we look at data sets today, and how do we identify? I think we all know that it's missing critical data from impacted communities. So how creative solutions around how can we bring those in, right? Those are the solutions we are looking for in our hackathon, which is on August 8th. It will be a 24-hour hackathon, but the registration has already begun. Teams are forming now. So if you're really Terence, Toju, everyone on the call today who are passionate about this topic, please join us and help us make a positive change. We have just a few more minutes. If anyone else would like any more questions?
I have one question, Toju. Just this morning, there was a news release about the England data set that was the largest ever, and they found the same disparity, which we already know, but this was like more documented. And it seems like South Asians and African Americans are disproportionately affected in the healthcare system. So even though it's all in the future, we are working on it, but what do you think we should do now so that people get access to care in those communities? Like right now within the healthcare community, what can we do as people to make sure that they get it?
Great.
Well, if the systems are very inaccurate right now, it's probably best not to use them. Right. The problem is, I mean, if it's gonna kill more people, at the same time, we're supposed to be saving lives, not allowing more people to die. I know that sounds like a very archaic, but the problem with that though is, it's many times it's volumes of people we're dealing with, and just humans alone cannot address those issues. So we do need some form of automation and AI systems. But I think for a short-term solution, if we feel that data sets that are currently being applied are not good enough, they're really rooted in bias, it's best to understand how much percentage of the bias that these communities, the Black and Asian communities, how much percentage of them are really being affected. And if it's a large volume, so I haven't read the news yet on that. So once I read it, I'll be able to understand. But if it's a very large volume, then yes, we have to teach whatever AI models have been applied there in the short term until it's fixed, because we can't be providing solutions that are not solutions, but rather killing people or oppressing people that have already been oppressed for centuries.
Yes.
If I may have just a quick comment, please.
Yes. Go ahead.
Today, if you look at today's environment, what has happened is our 100 years ago, who were our heroes, are now proved to be villains. And that
More
will
questions?
go
Terrence,
on.
I can see your, just connect with me on LinkedIn. I'm Toju Duke. So feel free to connect with me. I accept every request I get. And then
Sure.
carry on the conversation.
So how, as whoever decides, the committee, the group, it's beyond this, even the racial differential. It is thought differential also. Whatever we are thinking, like.
Any more questions?
Yeah.
Yeah.
That's all. But that's all my comment was. Thank you.
So, Toju, were you able to hear Ramesh's question?
No, I couldn't hear anything. I was wondering what was going on.
Oh, wow, that's why I was wondering if you were asking question while he was, asking his question. So I'm sorry. I don't know. Are you able to hear me?
I can hear you okay. I just couldn't hear Ramesh, and I was talking and telling Terrence to connect with me on LinkedIn because I didn't realize all this.
He was pointing out that it's thought differential that's causing this, So, oh, that's why you mentioned to connect with him. I see. I was wondering what was going on there. Okay.
Okay. I mean, Ramesh can type the question in the chat if we're having an issue here in Ramesh.
Yeah. No, that was a comment actually. How is this differential in the thought process? Whatever our value system was 100 years ago, that is changing with the times, right? And it will change even faster, depending who the leader is. Right? You can see that the person, from his thought process, what he thinks is right may be right or may not be right. So that thought process, I think that is also a key thing which has to go in this AI when the group decides.
I can't hear if Ramesh is still talking. I can't hear.
Okay.
Thank you.
No worries. Sorry, Rameshji. I'm not sure how this technical glitch is that some people can hear you. Some other people have also mentioned in chat that they're not able to hear you. I apologize if, I don't know why that's there because I can hear.
Okay.
Anyways, so are there any more questions from the audience? Okay, so in the end, I think this is an ongoing discussion, right? I mean, we don't have a clear solution for this, but these are some of the questions we do need to raise, and we need to ask these questions so that we can come up with a better tomorrow. And as Dr. Maria Van Kerkhove, technical lead at the World Health Organization, says, asking the question, are we doing enough regularly and repeatedly, is critical. With that, I want to thank Toju and everyone on the audience participation team to join us today and help us with this important topic and interesting conversation. Thank you, Toju.
Thank you. It's been great being here. Thanks for having me.
Thank you, Susanna.
Thank you.
Stefan, Ramesh,
Thank you so much, Toju.
Thank you to everyone.
Thanks, Susanna.
And thank you, Shilpi. Thank you.
Thanks, everyone.
Thank you,
and feel free to connect with me on LinkedIn and we can carry on the conversation there as well.
Sure.
Absolutely. And Toju, please join the Data Ethics for All community as well. And we can continue the conversation there too. Thank you, everyone. Have a great day. Bye-bye.
Thank you. Bye-bye.
Bye-bye.